Hi, everyone. This is Christy Keith. I'm a senior communications strategist for Fear Free, and I'm hosting this webinar tonight with our wonderful guest, Monique Feyrecilde. I will be with all the background noises from all of us working at home. I will be introducing her, but first I just wanted to make a couple of quick housekeeping comments. One, if you have any questions during the presentation, please ask them in the Q&A window, and Monique will get to as many of them as she can at the end of her presentation. And that's actually it. We just wanted to thank you very, very much for joining us here tonight. This has been an exceptionally difficult time for all of us as human beings. Veterinary medicine has faced a number of challenges that are unique to this profession. And we are so grateful to experts like Monique for reaching out to our community to share some of the information that can maybe make this easier for all of you. Our hearts at Fear Free are with all of you as we struggle with this, and we're just so grateful that you're here. We're also very grateful to Elanco for sponsoring this webinar tonight. Monique Feyrecilde is a full-time veterinary technician in small animal private practice with over 20 years of experience. She is a veterinary technician specialist in behavior and a past president of the Academy of Veterinary Behavior Technicians. She was a content contributor for the Fear Free Veterinary Professional Certification Program and is an experienced educator. We are extremely grateful that she joined us tonight, along with her African Gray Stanley Feyrecilde, who will be providing occasional commentary in the background. So Monique, Stanley, thank you so much for being with us here tonight, and please take it away.
Well, thank you so much, Christy, for that lovely introduction. Thank you to all the attendees for taking some time this evening to join me so that we can talk about a challenging topic that I'm sure is impacting all of us in our daily lives, inside work and outside of work. I live just outside Seattle, so we are in a place where we are on state stay-at-home orders, and veterinary services are still considered essential, but what we are permitted to do and are not permitted to do is changing on almost a daily basis. So the information I'm going to provide to you in the webinar today is based on my research and our personal experience. We have a fear-free certified practice, and we are doing our best to uphold all of our standards of care for fear-free while also keeping clients safe and ourselves safe during this outbreak. This is an unprecedented time for us all as humans. Like, it's just a hard time to be human right now. A lot of the clients that you encounter are going to be really stressed. It's going to be frustrating and upsetting for them, no matter what's going on. And coming to the vet is stressful under the best of times. Just be ready for those people. Hold some space for them. Understand that you may get feedback from clients that is unexpected or that may surprise you. You may get clients who are emotional and it comes as a surprise. Take a moment, have some grace, understand that we're all just doing our best on any given day right now. With respect to sort of special precautions, being in Washington and also worldwide, there's a lot that we can do to provide healthcare for pets and to provide support for clients as well, while still observing all of these precautions where we're working to keep ourselves safe and we're working to keep clients safe. There's a lot of words on these slides, but for webinars, I like you to have a little bullet list so that you can follow along with what I'm talking about. Team safety is... I'm not touching my computer, but my slides keep advancing. Christy, is it possible that that's you? There's I have no hands on the computer and my slide is advancing on its own. So just
no, Monique, you're screen sharing, so I have no control over your slides.
Okay. Thank you for your responding to that. I'm sitting completely still, not touching anything, turned off my watch. So I'm sorry for that unexpected slide advancement. With respect to human safety, veterinary teams, your safety is really important. Your bosses need to be providing you with a safe workplace, and that may mean that there is limited contact with clients if you're having contact with clients at all. The CDC recommendations are that any client who is ill stay home. I would highly recommend that you.
Monique, forgive me for jumping in, but one of the attendees said you might want to double check your PowerPoint because it has something called timings that auto advances slides. I just thought I would break in and
Oh, that might have been put in. So I sent them the plain slides and then they put them into the template for me. So I wonder if that came back with the template.
yeah, I don't know.
Okay.
Okay.
Sorry
All right.
about that. We'll all get through this together. uh, so with respect to the recommendations, we have been screening all of our clients in advance and asked them if anyone has been feeling ill to stay home and not come anywhere near the clinic. And we also have been asking if they have travel history, and if they've traveled within the last 14 days, we're asking them to give us space and stay home. If we do meet clients, we are doing curbside pickup and we are limiting the number of contacts. The CDC has requested that PPE be preserved for human use. I'm sure that you guys are having trouble getting PPE. When I say PPE, I mean masks, gloves, face shields, gowns, anything like that is very difficult to get, and the human hospitals are having trouble getting them as well. So it's not just us, but if we are using that PPE to do things like elective surgery, it takes them out of the supply chain for the human side as well. So preserve PPE whenever you can. If we're doing curbside and we're doing gown, gloves, mask for every curbside, that's PPE that may be taken out of the human supply chain. So just be aware of that. In Washington, we are being required to postpone elective care, and I do recommend that all hospitals postpone elective care. The definition of elective care is changing every day. Michigan just released a new guideline this afternoon about what elective care looks like. Right now, that's being managed on a state-by-state basis, so be aware of what's going on in your state with respect to elective care. I'm in Washington. The way that they're presently defining that for us is anything that is not going to threaten the life or health of the animal within the next 90 days, and anything that doesn't present a human health risk if it is postponed. Uh, Even if you are not allowing clients in the building, frequent disinfection is crucial of any high-touch surfaces. And then the AVMA has been recommending that we explore telemedicine options, and we'll talk a little bit about that at the end of the presentation. We've been having very good luck with telemedicine to help a lot of our clients and patients with zero contact between us and them, allows them to stay home and it allows us to stay safe. It can be a little bit difficult to maintain fear-free care because we're separating when, our office is doing curbside only. We're not letting any clients in the building whatsoever. And separating patients and clients can increase fear, anxiety, and stress for some patients. Those of us who are accustomed to practicing fear-free, we are accustomed to keeping those clients and patients together whenever we can, and that's just not possible right now. Clients can get really worried if we're working out of sight, especially if they are quite accustomed to being in sight. And also it takes the conversation about fear, anxiety, and stress off the table. So if we're accustomed to working with the client in the exam room and having the conversation of, oh, I'm seeing these signs of fear, anxiety, and stress, I think that we need to slow down or change our plan, or we need to talk about PVPs or this type of thing. If the client can't see what you're doing, it makes it difficult sometimes to start that conversation in the way that you've been accustomed to doing. So keep that in mind and be aware that that conversation may need to look a little bit different. You may also find yourself postponing or pausing and making a different plan more frequently if your patients are experiencing increased FAS because they have been separated from the client. You might also notice that if your team is wearing more PPE than they have in the past, some of those patients are going to notice your gloves and your mask. It's a visual change, and they may find that off-putting. And so be aware, be alert to their body language, and know that you look different even if you're somebody who's familiar to them. Some of you may have animals at home that if you put on a hat or you put on a big coat, even as their owner, it takes them a minute to decide that you're you and that you're safe. The same effect can happen with PPE, and many people are wearing more PPE than they have in the past around patients. So let's talk a little bit about how our practice is structuring these. And I've talked to a number of different practice managers and technicians and have received similar feedback from them as well. Before the visit, we're making sure we really look at the emotional record. If we have a patient that has a painful problem that can't wait, if we have a patient that has a injury, if they're having a severe illness, if they're having something that qualifies as essential with respect to our guidelines, and we are going to have them do a curbside visit, we're giving extra attention to the emotional record right now. If for some reason there's not an emotional record available, we're making sure that we do a fear-free questionnaire, pre-visit questionnaire by email or by phone to prepare in advance, because we want to know who is their preferred provider, what's the location that they want that the patient prefers to be. Do they like to be on the floor? Do they like to be on the table? Our exam rooms also have sofas or couches. A lot of patients like to have their exam on the sofa. What is the treat and distraction that the animal prefers? Do I have it on hand? Is it ready? And do they have individual handling preferences? Just all the things that you would normally pull out of the emotional record become even more important when we are in a situation where the client will not be on hand to remind us. So it's on us whenever possible to review, take a moment, and make sure that we are well prepared not only for the animal's medical needs, but well prepared for their emotional needs before we ever go and collect them from the client. Our practice is doing telephone history. So what happens is our clients drive up curbside, they call our front desk, the CSRs transfer the call to a technician, and the technician takes a full and complete history. Then our technician goes out to the curbside and collects the patient from the client. We try to, during that history, do some expectation management with our clients, and we found that that's really helpful. There was a little trial and error with this over the first few days, and doing some expectation management and talking them through what the visit will look like has been really helpful. Pardon me. When I say expectation management, what I mean is when I'm taking the history and I'm talking to the client, I say, I'm going to take your history. I have some questions and answers I'd like to go over. I want to make sure your concerns are addressed. Then I'm going to come out to curbside and what it's going to look like when they transfer the pet to me and what's going to happen while we are in the hospital, what their options are for observing the treatment that happens in the hospital, and how the payment strategy will go. So they get informed about that when they make the appointment, and then I go over it again with them while I'm taking the history so that they have a clear picture of what to expect. Clarity helps with diminishing anxiety for humans as well as for pets, and anything you can do to communicate about your new protocols before, during, and after the visit is going to be helpful to your clients. You need to have a safe transport strategy for bringing patients in and out of the hospital. And we're going to talk in just a moment about the picture of bringing patients in and out of the hospital in a little bit more detail. But when you're reviewing that emotional record, you really want to note patients that have known increase in FAS without the client. And if we don't usually give PVPs for that patient, we may want to consider doing it. If we know that the patient is ill and they have to come in and we know that we're going to have to separate them from the client, if they were on the edge in the past, it's worth having the veterinarian review that record to consider doing PVPs for this special situation where we know that the patient's stress level may be increased slightly. So when we're bringing pets in and out of the hospital, we need to make sure that they are safely confined and contained, that they are not going to escape from us or escape from the owner. For us, for our hospital, we are using clinic leashes only. We're asking clients to remove harnesses, sweaters, and other fabric items from the animal before we bring them into the hospital because those objects are perfect to be fomites. And so say, for instance, you have a client who's ill, they cough or sneeze onto the animal, they're handling the collar or the sweater or the harness with their hands. They don't have an opportunity for hand washing in between. So that's one way that our hospital is decreasing high touch surfaces between us and the client, as we're using our own leashes to bring patients in and out of the hospital. Since I checked the emotional record, I'm going to know what that animal's favorite treats are that I have available. If the client needs to bring those from home, we're going to talk to them about it just like we always do before every visit. When we go and do our greeting at the car, we're going to make sure that we're using that same body language that we would normally use. So approaching by turning to the side, letting the pet come to me, taking a moment and letting them observe me while I observe them. And then I'm going to offer them several treats if it's okay for them to eat, to see if we can't become reacquainted and they are ready to come with me into the hospital. When we're moving into the building with dogs, we want to face the direction of travel, face the direction you want them to go with your feet, hips, and shoulders if possible. Eye contact on them to make sure that they are comfortable and you can monitor their body language. You want to try and keep your leash loose and minimal pressure on the leash when possible. I like to use a trail of treats or luring to reward forward movement with me into the hospital. We are fortunate in that many of our patients have been coming to us for some time, and so they already have a really positive emotional response to coming towards the front door of the clinic. So it usually goes pretty well, but being prepared to take those extra steps to help invite the patient into the clinic will make that part of the visit go more smoothly. And that's the part that the client gets to see. The client's going to see when the animal is accompanying you into the clinic, and that's going to set the tone for how they feel about the handling that's going to happen in the clinic that's happening out of sight. If you're handling cat carriers, I would recommend that you use PPE when you do so and that you disinfect the carrier at your earliest opportunity during the visit beforehand, and that you also disinfect the carrier immediately when you're returning it to the owner. Some people are doing outdoor exams. Reminder that when you're doing outdoor exams, you need to make sure you're working in a secure area so that if the patient gets away from the client, there's not going to be any harm that comes to them. I know that sometimes clients overestimate their animal's ability to stay close and listen, especially during veterinary procedures. And if you are new to doing outdoor exams and have started to work outside, just make sure that you have some kind of secure system in place to keep those patients where they need to be throughout the visit. During the visit, once the patient is inside and you've collected your body weight or whatever your workflow is, and it's time for them to have their exam, we have been offering our clients a number of ways to interact with us during the appointment. So we use Zoom, Google Hangout, FaceTime, WhatsApp, or even just speakerphone to talk to the client while they are in the car. We have for our practice, we're fortunate in that we have multiple iPads and that our Wi-Fi signal reaches outdoors. So if we have clients who do not have a cell phone or they don't have the ability to participate in that way, we can disinfect an iPad and provide it to them so that they have the option, even if they wouldn't necessarily have that technology on hand anyway. All of these apps are available for all of your Apple and Android devices. They'll work on your Surface. There's lots of different ways that you can access these apps, and they're relatively easy to use. When we are setting these up in the exam room, we try to set them in a way that the client's view shows the animal all the time and at least one person. Sometimes the field of view is a little bit narrow, so they might not be able to see a technician, a veterinarian, and the animal all the time, depending on the size of the space you're working in, but we want them to be able to see the animal all the time. It's not ideal. I know it's easier to interpret and communicate with people when you can be face to face with them, but this is sort of the next best thing that we have been able to come up with for our practice, and that the practices that I talked to when I was researching to give this presentation for you have been using. Some clients will require additional coaching to be able to use the technology, but I think that it's worth it so that they can still maintain their trust that their animal is being handled in a way that's consistent with the fear-free values that they've become accustomed to expecting from your practice. So take a little bit of time if you're not doing these already and see about using some of these video conferencing apps so that they can communicate with you throughout the appointment. As a fear-free certified practice, we have a standard of care surrounding fear, anxiety, and stress scores, and we monitor those throughout our appointments. When we are doing our appointments, even though the client is separated from the pet, we're still maintaining our hospital standard of care for FAS scores. Different hospitals will have different standards of care, but we are still maintaining our pause, postpone, and plan based on the animal's FAS score, even if the client is not present. So say, for instance, that animal is normally a 2 and they're going up to 3 or 4, and we think the reason is because they're separated from the owner. We're not just powering through, we're pausing and making a plan. Do they need to be sedated? Do we need to do this with PVPs? Is there any part of this that can be postponed because it's not really essential? We still are going to need to pay attention to the FAS scores of those animals. we're going to use all of the usual fear-free strategies that we would normally do. So we're going to make sure that the sounds and odors are amenable for the animals. We're still playing all of our through a dog's ear and through a cat's ear in our exam rooms, even though they're not getting as much traffic right now. We're going to make sure that there's no unnecessary social interactions between the patient and other staff members. So I had a fellow professional mention that they were having a great time because everybody was getting to play with the puppies in a way that they wouldn't normally do. And I would say try to make the visit look as normal as you possibly can, rather than changing your workflow just because there are no clients in the hospital. You're still going to want your pheromones to be in place. You're still going to make sure that you're providing that animal with a non-slip surface or a comfortable area for their exam and treatment. You're going to use their preferred locations. You're going to provide their preferred provider if that's at all possible. All of that is part of your considered approach. Still use touch gradient when we're examining, treating these animals, and we're going to use gentle control if we need to stabilize them, as well as providing all the treats like we would just like when the client is present. I think sometimes it's easier to remember to do that stuff because the client presence prompts us to remember that this is somebody's family member. It's still someone's treasured family member, even if they are separated from the client. And so please continue to use all of those same strategies as you normally would, and continue to pause, postpone, and plan as needed based on the animal's FAS score, even though the times that we are in that are surrounding this treatment is difficult or the circumstances have changed. It doesn't mean that our attention to animal FAS needs to change. If your clinic does not do a lot of PVPs and sedation protocols now, take a moment and sit down and review some of those so that you have a few more at hand. Module 7A and 7B go over a wide variety of different PVP options and sedation protocols that are available and have been prepared by veterinary behaviorists for fear-free certified professionals to use. The drug reference sheet and the nutraceutical reference sheet are available in the toolbox in your fear-free account, and the transcripts from modules 7A and 7B are also available through your fear-free account for a quick review of those different medications and cocktails that you might be reaching for perhaps a little bit more frequently than you did when you were able to have the client present throughout the procedure. I will say that our hospital has been having very good luck with telemedicine. You need to consult the AVMA guideline and you need to look at your individual state guidelines, because states, what is allowed for telemedicine is changing on a daily basis, and it is regulated by your state practice act. It's not regulated by, it's not federally regulated or nationally regulated. So for telemedicine, before you dive into that, do make sure that you check your state practice act and that you're staying within the guidelines that have been set forth so that you are within your scope of practice for your license. And that applies for veterinarians as well as any other licensed or credentialed veterinary professional. Many states are allowing a huge expansion of what can be treated via telemedicine during this crisis. I know in Washington, essentially our telemedicine recommendation at this point is anything can be treated by telemedicine at the discretion of the veterinarian. So they are really trusting veterinarians to make those decisions and to handle this on a case-by-case basis so that animals can receive diagnosis and treatment as possible via telemedicine. Individual veterinarians, so what that means for us is individual veterinarians are deciding which cases they're comfortable seeing remotely, which things need to be seen on emergency. Our local emergency clinic, the wait time 7, 8, 9 hours right now, even for animals that are sick or injured, not just for people who are going to the emergency clinic even though their animal doesn't really have an emergency. So we're doing our best to stay open and treat as many of these things as we possibly can so that these animals get treatment without their owner being exposed to a lot of other people and it causing increased staff exposure at the emergency hospital as well. So telemedicine is a great way to sort of decrease the number of total social contacts that happens between humans, and decreasing the number of total social contacts between humans is going to be critical to sort of flatten the curve, is what everybody's been talking about. Every person that we come in contact with, we're really coming in contact with everyone that they've been in contact with. And it's this large tangled web. So anything we can do to decrease the number of interhuman contacts, the better during this crisis. For our hospital, the way that we're working telemedicine is we have a designated veterinarian that does telemedicine appointments throughout each day. One of our veterinarians is working 100% remotely. Our other veterinarians are doing a combination of live exams and telemedicine when appropriate. We schedule their appointments into designated time slots, and the veterinarian sends out to the veterinarians or the CSRs, depending on who is working in our practice on that day, sends out to the client in advance what their telemedicine options are. If they want to use FaceTime, if they want to use Zoom, if they want to use Google Hangout, we get them a link going. They get connected up during that particular appointment, and then we have a designated technician per veterinarian who does all of the medical record keeping if our veterinarian is working remotely. So that all of that gets written down. We have great communication back and forth, and then we also can screen share our medical records to the veterinarians even when they are working from home, so that they're able to have access to all the patient files, all the patient medical records throughout the patient's treatment period. If they need to have prescriptions, we can get those called into a pharmacy, or in some cases, if they're veterinary only and the human pharmacies don't have them, we will package those up and place them curbside and then have the client pick them up, so that there's zero person-to-person contact during that phase of treatment. But telemedicine has really been allowing us to treat a lot of things that aren't emergent. They don't need to come in. You don't need to sustain a human interpersonal contact for those, but still the animals get relief from their discomfort or illness through zero contact treatment options, which is very new to veterinary medicine. Veterinary medicine has really been extremely restricted on telemedicine in the past, and we're just doing our very best to care for as many patients as possible while staying within the new guideline of veterinary discretion for Washington. So with that, I am happy to, we have about 5 minutes where we can take questions, I believe.
Yes, we have a few questions. Thank you for that great presentation. I learned some things, and I know there's probably a lot of questions out there that might vary from state to state, but we also have some great general questions here. One of them is a pretty simple question. Are you washing the clinic leashes between each patient?
Yes. We use them once and then they go through the laundry. That's correct.
Great. Should you allow treats to be brought in from home?
So that's going to be on a case-by-case basis. If there's only one thing that that patient can eat without getting sick and I don't have it, we will do it, but we're really trying to minimize the number of things that come in and out of the clinic. So only in cases where it's absolutely necessary.
Here's a great one from Dr. I'm sorry, I don't know how to pronounce your last name, although I've seen you present many times. Fedak as a veterinary dermatologist. We have always advocated for seeing pets with skin disease. While allergies won't likely kill them, they do need to be managed. How are you managing allergic skin disease?
So we are trying to do as much of that as possible by telemedicine. There's a lot that you can handle by video for allergic skin disease is our personal position of the veterinarians that I work with. I'm a technician, so I don't make those, I'm not a diagnostician, right? We're doing a lot of them by telemedicine. It's going to vary state by state. So for instance, like the Michigan ruling that just came out, it absolutely would not be okay to do any kind of treatment for allergic skin disease. And while I completely agree that those animals are it's going to be state by state whether it's even legal to treat allergic skin disease right now. But we're doing almost all of ours by telemedicine. If they need to come in for their Cytopoint or that kind of thing, if we need to get them some Apoquel for a couple of weeks to tide them over and get them to be less pruritic, that kind of thing, that's what we're doing. A few of our telemedicine cases also for skin disease, we've had them, the veterinarian makes their recommendations and orders tests, and we'll have a technician do curbside diagnostics, and then we'll prescribe from there.
Wow. When using FaceTime, Zoom, etc., are you using your personal cell phones and calling the owner's phones?
So for our clinic, we have several iPads that belong to the clinic, and we use them Wi-Fi. And so we're using, so not necessarily. Some of us will use our personal cell phone. Like my personal cell phone is also my business phone number, which is on the internet and available to anybody who's smart enough to spell my last name. So it doesn't bother me to use my personal cell phone, but no, we have clinic devices, so we are not requiring staff to give out their personal cell phone number, no.
I got multiple questions about the problems of disinfecting carriers when you have to
Mhm.
carry the pet in, both just generally, how do you do it? And secondly, how do you do it when cats can find so many disinfectants adversive and stressful?
So for our hospital, it's, you know, you have to choose the lesser of the evils, right? There's no perfect solution to this problem, but for us, we use rescue wipes, or right now we're using appropriately diluted rescue on whatever we can use as a wipe, because we can't get wipes and we are out in our particular clinic. But we are using rescue to disinfect the side of the kennel, and we are using gloves to handle the kennel until we can disinfect it. So.
Great. We've got a lot more questions coming in. Some of them are general about fear-free practice. We're going to skip those because they're not related to the pandemic response. But we also have a lot of questions about telemedicine apps and logistics of telemedicine. We're really out of time, but if we could just wrap with that topic. The questions, well, actually, there's two questions, if you don't mind staying a few extra minutes, Monique.
I have plenty of time. I am happy to do whatever works for you.
Terrific. A lot of questions about the different telemedicine apps. Wondering if those are really better than something like Zoom, and then other people wondering about, if you have any app recommendations or commentary. So anything that you want to say about telemedicine, the logistics of telemedicine?
I can only speak from the experience of my own practice and the other practices with which I've spoken directly. And for us, we are choosing to simulate as much of the client experience as we normally would. We're just doing it through existing apps that we already had, through Zoom, through FaceTime, through Google Hangout, that kind of thing. So essentially, we're just doing video appointments. We did a lot of those before because we treat a lot of behavior cases, and those people might live 3 or 4 or 5 hours away. So we kind of already had a little bit of infrastructure in place to do that. There are a number of telemedicine apps that were becoming veterinary medicine over the last few years, but most of those are teletriage, to my understanding, meaning that clients can contact those representatives and help make a determination about whether they really need veterinary intervention or not, but it was not a complete diagnostic and treatment tool. I'm sure there are other apps that are beyond my knowledge base. I can't speak to those specifically because I have not used them, but that's what we've been doing that's been working for us.
Great. And one of our attendees just sent a note that there's a veterinary telemedicine Facebook group with a lot of info and resources. I've been hearing a lot of people talking about that. I'm not sure the exact name, but probably if you search on Facebook for veterinary telemedicine and select groups, it will pop right up. The final question that I wanted to ask Monique is one that I know has caused a lot of people a lot of stress, which is, are you making exceptions for clients to come into the building for euthanasia?
This needs to be on a case-by-case basis for what your hospital and your team can do that works for you. For us, we fortunately have not had to do very many euthanasias over the last couple of weeks, but we have been doing them outside when possible. So meaning that our practice is set up so that it is relatively easy for us to go administer sedation in the car. And then we have the owner stay with their animal while they're sedated in the car, and then we will go and maintain as much social distance as possible. So for instance, we'll have the owner step away from the sedated animal, we'll place an IV, place an extension set so that we can stand farther away, then they can approach the animal again and be with them, and then we can do their final euthanasia medications through an extension set. It's not ideal, but end of life care is really important, and we need to be able to relieve those animals' suffering and help them have the best end of life care they possibly can while doing what we can for the client. Uh, that's the solution that our practice has. We also use PPE when we're doing that. So we are masked, we're gloved, and ordinarily during euthanasia, that's not something that we would do. That doesn't mean it's the right answer. It's the answer that we are doing. I will say also something that is a little bit different, just as our part of our general euthanasia protocol, is we use high dose PVPs for all of our euthanasia. So these animals, when they're showing up, are already super de-stressed, very calm. Some of them are quite sedate from oral medications that are administered at home before they ever even show up in the parking lot. And that is something that I think you will find helpful regardless of what your decision is about clients in the building or not in the building, or working a little bit closer than you want to be to them, but staying outside. Starting with a patient that's much more relaxed is going to make it better for everyone.
Thank you. Thank you very much. Thank you. First of all, I want to say that we had over 200 attendees at this webinar, and we're so grateful to all of you for wanting to preserve as much of the fear-free experience as possible for your patients. Thank you so much for your dedication in this almost impossible time. We are really humbled by your commitment. And thank you so much, Monique, for sharing your experience and your thoughts with us tonight. It was very valuable, very helpful. And finally, thank you very much to Elanco for sponsoring this webinar. We would like to invite you to visit fearfreepets.com/webinars to see the other webinars that we have in this series. We are adding more. And as long as you keep wanting this information, we will keep providing it. And thank you again, everyone, so much for being here with us this evening.